Hi everyone, this is Sadia Jalisi, and today I'm going to present an antiviral therapy as a pharmaceutical representative to healthcare providers. And my topic of discussion is Harvoni. That's a combination of sofosbuvir and levetiracetam, and it's a revolutionary change in hepatitis C treatment. First of all, I will introduce the disease that is caused by Harvoni, that is the main cause that is treated by Harvoni is chronic hepatitis C infection. So chronic hepatitis infection, viral infection caused by hepatitis C virus, and hepatitis C virus is RNA virus that belongs to Flaviviridae family. Incubation period of this virus is about 2 to 6 months. And first of all, acute hepatitis starts after the infection, and usually it's undiagnosed, asymptomatic, and around 55 to 85 patients develop chronic infection. And if the because it's usually asymptomatic, it is also known as silent infection. But if the symptoms appear, it includes like abdominal pain, body aches, and fatigue, fever, jaundice, joint pain, loss of appetite, nausea and vomiting, and so on. Its mode of transmission includes intravenous drugs that is constitute about 90% of transmission, like sharing needles between the drug users, like contaminated needles over here you can see, and the non-intravenous drug exposure, like using, like sharing inhalatory instruments, or the others include like accidental exposures, like needle stick injury, and the healthcare procedures. Like here, we can see like contaminated dialysis equipments, contaminated vaccination equipments, non-sterile body piercing equipments, or non-sterile dental practices, and so on. Also, some amount of transmission could occur by vertical transmission, that means from mother to the child, but it's just 3 to 10%. It are also very low, it could be transferred through sexual exposure. Now we will move on to the genotypes of the hepatitis C infection. So it has seven major genotypes and several subtypes. They vary in virulent and geographical pattern and respond to treatment. It includes genotype 1. We'll discuss only the major genotypes over here. Like genotype 1 is the most common in the United States, and it includes subtype 1A and 1B that causes 60 to 70% of the cases. Genotype 2 is the most common in, like it's all over in the world, but it's more common in Central and West Africa. Genotype 3 is very common in South Asia among intravenous drug users, as I told you before. Like it's very common disease between intravenous drug users. And it has increased risk of hepatocellular carcinoma. We will discuss it later on in detail over here. So first we first like if we if there is a normal liver as is shown here, and if it gets infected with hepatitis C virus infection that is acute, then 55 to 85% in cases it converts to chronic state. And then after its conversion to the chronic hepatitis C virus, it then develops into the cirrhosis in 20 to 30% of the cases, and then the hepatitis C related cirrhosis have approximately 1 to 4% risk per year of developing hepatocellular carcinoma, and then 2 to 5% risk of end stage liver disease. So these are all the potential risks of chronic hepatitis C virus. Now we will move on to the replication cycle just to understand the basic mechanism of the drug. So here, first of all, virus enters through attachment and entry, and the virus enters the cell through receptor-mediated endocytosis, and then uncoating occurs. Viral RNA is released into the cytoplasm, translation, and the mRNA converted into the protein, RNA translation into the single polyprotein, then cleaved into structural and non-structural proteins over here. So here, the non-structural these proteins include NS3, NS5A, NS5B. That are important. So RNA replication then occurs, and it occurs in the membranous web structures. NS5A, NS5B mediate genome replication, and then assembly and release occurs, and it released through exocytosis. And now I will present a case over here, like a male 55-year-old comes with a complaint of persistent fatigue and discomfort in the upper right quadrant, and his blood reports showed elevated ALT AST level. And when he was done with HCV RNA testing, it confirmed that he has chronic hepatitis C genotype 1A infection, and his viral load was like 2.5 million IU per ml, that is low, and he had no history of cirrhosis or comorbidities. So for him, the best choice of treatment would be Harvoni, that is ladipasvir, 90 to 400 milligram once a day for 8 weeks. For 8 weeks, because his RNA, HCV RNA is lower than 6 million IU per ml. So if it's more than 6 million IU per ml, we will prescribe for 12 weeks. Now I will tell you why. So Harvoni is a combination drug of two, like ladipasvir and plus sofosbuvir. So it is a first combination tablet approved by FDA for the ICV genotype 1, specifically genotype 1A, and its mechanism of action includes, like, ladipasvir inhibits NS5A proteins, and the sofosbuvir inhibits NS5B protein, and both of them in this way they um, uh, they stop the replication cycle. So the sofosbuvir is this NS5B protein inhibits the NS5B protein. This protein is RNA dependent RNA polymerase that is required for viral replication, and so they terminate the viral RNA chain during replication by being incorporated into it, and they stops the genome replication. While ladipasvir is inhibitor of NS5A that is required for HCV replication and viral assembly. So this is how they interact with the hepatitis C infection. Now, we will move on to the efficacy of the Harvoni. So there are three clinical trials that were done, and to evaluate its effectiveness. And this series of major clinical trials that are called iron trials that were conducted, and they had three study phase. First is IL-1 treatment. They included the naive patients, that means who had never been treated before, and IL-2 treatment with experienced patients, that means that who had failed previously with previous other treatments, and now we will treat them with Harmony. IN3 treatments, IN3 group includes the shortened period, that is 8 weeks, naive patients. That means like they treat, instead of 12 weeks, they treat them for 8 weeks, and that could be enough for some patients that are naive patients, the new patients. So all these trials, we'll move on to the results. All these trials showed a very like good cure rates, even in the difficult to treat patient that is with cirrhosis. So the standard 12-week regimen cured almost everyone, and in some cases, 8 weeks was enough. The most important thing is the ribavirin was not always necessary. That helped to reduce the side effects of this drug, as we used ribavirin in previous treatments. So in this drug, there is no ribavirin. Now, for the first group, 12 weeks with Harvoni without ribavirin is effective for new untreated patients. Then, in the second iron 2, 24 weeks with Harvoni may prevent relapse, while 12 weeks treatment resulted in 94 to 99% of SVR12 for previously treated patients. SVR12 is like sustained virologic response that is used to detect the undetectable hepatitis C virus after 12 weeks of treatment ends. So that is very high. That means it's a successful drug and the virus is completely eradicated. So in third case group, 8 weeks with Harvoni is effective for selected patients. Biological relapse occurs in 3 to 3.5% patients, and 93 to 95% SVR12. That is very good. So here is another clinical trial for children that was occurred like for the children, for 50 treatment naive children that was aged between 12 to 18 years old and less than 25 kg with chronic hepatitis C virus genotype 4 in Egypt. So they divided the groups into two, and without comorbidities, it showed 100% SVR12. That is, it means the drug was very effective, and it's so 100% with minimal side effects. Treatment proved effective and safe with or without chronic disease. So the results was very successful, high sustained virologic response rates, and the treatment was well tolerated among children with minimal side effects, and significant improvement in the liver enzymes was seen, like ALT and AST level. So Harvoni demonstrated over here that its high efficacy and safety in treating chronic hepatitis C virus genotype 4 in pediatric patients, including those with comorbid conditions. Now we got another clinical trial for chronic hepatitis C virus with Porphyria cutanea tarda. So it was conducted among 15 patients that had genotype 1 chronic hepatitis C virus with Porphyria cutanea tarda. 12 patients was successfully cured, and only one of them relapsed but cured with other treatments later on. It's proved that if it's very effective and solely treatment of chronic hepatitis C infection along with Porphyria cutanea tarda without additional treatment. So it can treat both of the diseases, like it's a skin disease, Porphyria cutanea tarda, along with chronic hepatitis C infection. We don't need any other additional treatment with with if we are giving Harvoni. So there are some treatment options that are recommended by FDA, and it also shows the percentage of cure. Like I can tell this one, like genotype 1, and the genotype 1 that was for the naive patient with no cirrhosis, we can give for 12 weeks. If we give for 12 weeks, that is recommended, then 96 to 99% it's cured. If like I told you before in the case study, like if HCV RNA is less than 6 million copies IU per ml, then we can consider 8 weeks. Like in that case study, we did for the 8 weeks because their SCV RNA was low. But if SCV RNA is high, like over here we can see like 6 million, more than 6 million, then we have to do the 12 weeks. And also with if comorbidity like liver cirrhosis, we have to do the 12 weeks. And genotype 1 treatment experience no cirrhosis, it's also 12 weeks and 95% success rate. Then genotype 1 never treated or treatment experienced patients, it's recommended for 12 weeks with ribavirin class B. Now I can compare this drug with Vicera pack that's also used for chronic hepatitis C virus infection. So, as we know that Harvoni is a combination of two drugs, laripasvir and sofosbuvir, and but Vicara pack is a combination of these four drugs, uh, ambitasvir and paritapivir, ritonavir, and desabuvir. So here we have a comparison, like we did the clinical trials between these two medications. So here you can see like the iron 1, iron 2, iron 3 clinical trial group name, as we can discuss this one. And in Vicra pack, they did the Sapphire 1 that includes the treatment naive with no cirrhosis, Pearl 3 G1B treatment naive with no cirrhosis, and Pearl 4 GT genotype 1A treatment naive with no cirrhosis, and Turquoise 2 compensated cirrhosis. So they had different treatment options over here for these patients, like Vicra pack, they give everyone this, and in iron, they give Harvoni. In iron 1, iron 2, iron 3, they gave the Harvoni, and in these group, they gave the Vicra pack. Then it shows the number of enrolled patients over here, then treatment durations, and then the SVR rate, that is serologic viral response, sustained virologic response, that was high for both of them, and rates that indicates that it's very strong efficacy. While both treatments have low rates of virologic relapse and breakthrough, but Harmony shows us slightly fewer instances, potentially indicating a more robust viral suspension. And Harmony has a lower discontinuation rate, as you can see over here, than the Vicrepac. So, when selecting a treatment regimen, consider efficacy, safety, patient adherence potential, and specific clinical scenarios to optimize the outcome. So, for all this, like for well toleration and less relapse and more SVR, we recommend Harmony. Now we will move on to the adverse effects of Harvoni. It has very like less common side effects, like that includes nausea, vomiting, diarrhea, insomnia. But common side effects is like headache, drowsiness, fatigue. And in phase 3 trial, some patients also showed hyperbilirubinemia, transient and asymptomatic lipase elevation, and mean hemoglobin change of zero point 0.2 to zero point 0.6 gram per deciliter. Life-threatening condition it can cause if it's used with a drug that is amiodarone, and it's contraindicated with certain HIV retroviral drugs like Strepsils, Atripla, and Activus. So here is a conclusion like it's proved that it has high efficacy, safety, and simplicity in the treatment of chronic hepatitis C virus infection of genotype 1, specifically genotype 1A, among variety of patients, that including with cirrhosis or without cirrhosis. So efficacy, like it showed very high efficacy, and SVR rates were 94 to 99% among IN1, IN2, and IN3 trials, and it worked with both cirrhosis and without cirrhosis. Also, the one of the benefit is like it's interferon and ribavirin free regimen, so it has no side effects that were caused previously among patients using these drugs. Also, it's very easy to use for the patient because it's just one dose per day. That is easy with busy schedule and of the patients, and it's also well tolerated with fewer side effects like I discussed, like headache and nausea, and these are less common side effects. So it's well tolerated among patients and also among children's of like age, and it has low virologic failure rates. And also for non-cirrhotic patients, this drug can be prescribed for 8 weeks only instead of 12 weeks. So it's a convenient drug and patient friendly. So we'll highly recommend this. And with strong real world data and guidelines endorsement, Harvoni remains a cornerstone therapy for hepatitis C virus genotype 1. It's helping us move us closer to the goal of eradicating hepatitis C virus as a public health threat. So these are my references. Thank you.